Every day, you breathe around 20,000 times. It is an involuntary, constant rhythm that sustains life. You don't consciously think about this fundamental act. You simply do it. But what about air quality? In this episode, we will discuss one of the most important yet invisible achievements of the European Union: air quality regulations and protections. Air pollution doesn't manifest with dramatic flair. It doesn't announce its presence with the immediate devastation of a flood or the terrifying roar of a fire. Its danger is far more insidious. Despite its quiet nature, air pollution stands as one of the biggest environmental health risks we face globally. It is directly linked to a host of serious conditions, including asthma, heart disease, and stroke. This silent threat contributes to hundreds of thousands of premature deaths every single year across Europe. The true peril of air pollution isn't its loudness or its visibility. It is precisely its invisibility, its pervasive and unseen impact on our health and well-being that makes it so dangerous. For many decades, dirty air was often accepted as an unavoidable consequence of progress. It was seen as the unfortunate price of industrialization and economic growth. This perspective allowed the problem to persist. However, air does not respect national borders. Pollution generated in one location travels freely, carried by winds and weather patterns. It harms people and environments far from its original source, demonstrating a shared vulnerability. It was at this point that air quality transcended being merely an environmental concern. It evolved into a complex European issue, demanding a coordinated cross-border response. In response to this shared challenge, a groundbreaking shift occurred across Europe. Comprehensive shared air quality standards were introduced and implemented. These standards established strict limits on the most harmful pollutants found in our atmosphere. These limits were not arbitrary. They were meticulously based on robust scientific evidence and research. Their effectiveness was ensured through constant monitoring and rigorous enforcement by law. For the very first time, national governments were not just encouraged to protect the air their citizens breathed. They were legally required to do so, marking a significant step forward in public health. Once air quality could be accurately measured and its impact quantified, it became impossible to ignore. This new understanding spurred tangible changes in communities across the continent. Cities began to rethink and redesign how traffic flows through their streets. Industries were compelled to invest in cleaner technologies and significantly reduce their emissions. Urban spaces were reimagined, prioritizing pedestrian zones and green infrastructure. These transformations weren't solely driven by individual citizens suddenly adopting better habits. They were made possible because shared, enforceable rules created a framework for collective protection and improvement. Over time, the impact of these policies began to emerge, quietly but profoundly. Pollution levels across Europe steadily declined, leading to a healthier environment for everyone. This improvement had a direct effect on public health. Hospital admissions for respiratory and cardiovascular issues saw a noticeable decrease. Crucially, life expectancy began to increase, reflecting a population living longer and healthier lives. These changes did not happen overnight, but they unfolded steadily and consistently. This is a powerful example of what effective, long-term prevention truly looks like. The implementation of robust air quality standards holds particular significance for those who are most vulnerable. These policies offer crucial protection to children, whose developing lungs are especially susceptible to harm. They safeguard older people, who often have compromised respiratory and cardiovascular systems. Furthermore, these standards provide essential benefits to communities living near busy roads or industrial areas, who are disproportionately exposed to pollutants. This isn't merely about convenience or minor improvements. It is fundamentally about fairness and ensuring equitable health outcomes for all. Some of the most pressing problems we face cannot be solved through individual choices alone. They demand collective responsibility and coordinated action. We often fail to notice the presence of cleaner air because success in this context simply feels like normal life. When a problem is effectively managed, its absence becomes the new baseline. This makes it remarkably easy to forget that these vital protections exist at all. It also makes it easy to underestimate the severe consequences that would arise if these safeguards were to disappear. However, human biology does not compromise on its needs. The air we breathe does not negotiate its quality. This is the core purpose of EU in practice. Our aim is to illuminate and make visible the complex systems and policies that work so effectively that we often cease to perceive them. We want to highlight the quiet successes that shape our daily lives. Alongside this video, you will find a comprehensive long-form article that delves deeper into this topic. We also offer classroom activities specifically designed for educators and young people. These resources aim to connect the abstract world of policy to the tangible realities of everyday life. Cleaner air may not feel like a political issue in our daily experience. Yet its very existence is a testament to political will and collective action. Every breath you take carries the subtle imprint of shared choices. These choices were made to protect something fundamental that we all share and depend upon.